Welcome back. On Thursday, the groundhog told us we technically have 6 weeks left of winter. Well, it's hard to tell in the Bay Area since it's been 80 degrees. We're joined now by Dr. Seth Forman, who has some skincare tips for the dry end of winter days. Okay, obviously it's not cold outside at all, but
no, it's not that
still
cold.
Can have an effect on your skin.
Yes, it can, because it's actually not the temperature itself that's causing the dryness and the cracking that some people get on their skin. It's actually the lack of humidity. While it's very humid during the summer and the spring, it's actually not very humid now, so people are getting drier skin.
And you really need to take care of that. You shouldn't just let your skin be dry all the time.
Exactly. You don't want it to be dry. It can crack, and some people it cracks so badly it actually bleeds. So there's a number of products I have brought here that I actually usually advise my patients to use on a daily basis. And they can use it for themselves and on their children. Remember, children also can get very dry skin. They can get eczema. And also, especially babies, when you're changing diapers and things like that, you really want to make sure their skin is protected.
All right, so talk about a few of these and what they do for us.
Well, some of these are just some of your routine moisturizers, and these are very inexpensive. These are available at your local grocery stores or pharmacies. And say, for instance, like CeraVe, this is a very popular product. Many patients find this very pleasing to their skin. It can actually prevent the cracking. It actually helps create a barrier on their skin.
Is this something you want to use every day, twice a day? How often?
Well, it all depends on, it's unique to the individual. Some people need to use it more than once a day. Some people need to use it once a day. Some people only need to use it, you know, not very often at all. So it all depends on the cold. Okay.
And how much dryness you're seeing?
In feeling. Okay. You know, sometimes the dry skin can actually make you feel itchy. So if you, while it may not show that you're dry, you may feel dry. So use it, it can help prevent the itching. It's
not going to do any damage if you're using the moisturizer.
You're not going to overdose on moisturizers unless you decide to eat it.
Don't eat it.
Don't eat the moisturizers. But I'll say what's really important, what I wanted to show you, Allison, and show your viewers today, is that while it may be cooler, it's not cold, but it's cooler here in the Bay Area, you still need to use sunscreen. The UVA and the UVB rays can get through the clouds and still cause sunburns. Like, for instance, skiers, while they're all bundled up and they have their hoods on and their mask on, they're still getting sunburns because they're not using sunscreen. So even though it's cooler, their sun is still getting through, and you can still put yourself at a risk for skin cancer. And while young people don't really care about skin cancer, you might want to tell them, well, you might wrinkle later on if you don't protect yourself.
And usually you should be finding a moisturizer with some kind of SPF in it.
Exactly, at least for your face. At least for your face, and say like your hands or arms, because this can still protect you and still moisturize your skin and prevent that itching and dryness that a lot of people experience.
All right. Dr. Seth Forman, thank you so much for joining us this morning. Get that moisturizer on, even though it's winter and it's warm here.
That's right.
You still need it. Thanks so much for joining us.
Thank you.
Mark?
So important, the UV protection, even during winter.